All right, so now we're going to do the catheter. The major thing is maintaining sterile field. So there's a good possibility that I may break sterile field. The point is that you know when you broke sterile field. So if you say to me and Tina, oh, I broke sterile field, we're not going to be like, oh, you failed. We're going to be like, oh, okay, good. You acknowledged it, so you know not to do that again. Remember, these are not real people. You all can't kill these, so it's okay. All right, so the first thing we're going to do, we're going to verify the order, assemble the equipment, wash our hands, identify our patient, provide privacy, and explain procedures. I do always keep a pair of non-sterile gloves, these, on while I do this procedure, and I will show you why at the end of this. Some people do, some people don't. I do. Okay. So then your paper will tell you to assess the status of your client. When did they last void? Make sure that their bladder's okay. Check their eyes and nose, their level of consciousness, their mobility, all of that. So you are going to want to do that. You should know your patient. Some of them can't help you move their legs, so you should know that. You want to make sure that their bladder, feel of their bladder, ask if they're having any pain, feel their abdomen, see if they can follow instructions, make sure you tell them what you're going to do. And it says to stand on the side of the bed. If you're right-handed on the left side, left-handed on the right side, vice versa. I stand where I'm most comfortable. That's neither here nor there. That's up to you. All right, so the first thing, it says that you are going to place a waterproof pad under your client. And of course, I would have provided for privacy at this point. And we're going to pretend like we have a waterproof pad under my client there. I don't have one right now, but we're going to pretend that there is one. All right, so then, and again, I've still not touched my catheter yet. Then I'm going to get my patient in the right position. And as you can see, I've got a female here. So I always tell patients, butterfly your legs out for me. If they can kind of follow that instruction, that's good. Our patient's already got some leg issues, which I think is good for you guys to see, because you see that you can be kind of limited in your movements. One of the hardest things is putting a catheter in patients who's got a broken pelvis, so yeah, it gets difficult. All right, so now we've got our patient ready. We're, of course, not going to uncover her anywhere else. And it says to wash the area with soap and water if needed, and then throw those gloves away. I was an ER nurse. We never washed them. We just put the catheter in. But you should wash the patient first. And then throw those gloves away. And then I would put new gloves on. That's just me. I like to have the gloves on. So I've got my gloves on here, and I'm going to start with my sterile field. So the first thing, you're going to pull that. And now we're going to take our box out. This is not sterile. I use this as my garbage. A lot of nurses do that. So I usually just put it somewhere that I can use it as garbage. Okay. You may want to keep this on if you're doing this on a real patient, because you can label your insertion, the date, and your initials as to when you put the catheter into the patient. So you may want to keep that. I'm not going to keep it for now, but that is something you might want to do when you're actually doing this. So you have a little bitty tab right here. So you're going to touch that tab. It tells you where to touch it, okay? Because we're starting into the sterile field now. The hardest thing is making sure that this stays where it's supposed to go. You are only to touch at the corners. And it's folded to where it helps you to know what you should be opening. And you see how that's wanting to pop back up on me? So I need to grab it by this corner too and pull it down. All right. So now I have my sterile gloves. You do not want to touch anything else around this except for those sterile gloves. So pick those up. And you're going to take these away from your sterile field, because now these aren't sterile. I've touched them. So we're going to go right here. I want to make sure Tina can see me. All right, we're going to go right here. Open these up, and remember this is something I showed you guys in class on how to do this, and you can put these right on top of your gloves that you already have on. That's what I'm going to do. So you grab by that cuff, and usually they're pretty big in these catheter kits. I don't know if this one is or not, because it might not go over my hand. All right, so I've got that one on. I've ripped my glove. You all would not want to do that. Now you're going to go under that cuff. Ooh, ooh, ooh. I'm getting all tangled up there. Okay. And pull that glove on. So now we've got our gloves on. I'm going to straighten them because now I'm sterile. Okay? So I can't touch that. Can't touch anything but sterile stuff right now. So I'm going to pull this back around to where I can get to it. We don't want that anymore. Okay. So I'm going to take this out. This is just something that I use just to kind of keep the bed from getting wet in case like urine falls out. So I just kind of put that in between the patient's legs. This one, as you can see when you look at it, it has a little hole cut out. See that right there? It's got a hole cut out. So I'm going to actually place that over my patient's legs. You don't want to touch the patient as you're doing any of this. All right, so then we've got our swab sticks. This comes with like 2 packs of swab sticks. We don't need both of those. So just one. And what I do, you open that up. This is garbage. Don't touch your garbage though, just like lay it over there. And you get 3 swab sticks. So I put those right here. Now this can go over here to keep on the sterile field. And actually you can do this too. I've seen this happen if you need to adjust, you can go like this because you're still in the sterile field and move that to here and you can like do that. Okay, so you're still in the sterile field and you can do that. All right, then we're gonna I'd get all this stuff prepared before I go towards my patient. This is to fill your balloon up. So I take this and I go ahead and hook it up to where it's going to fill up my balloon. Some books tell you to test, some books tell you not. I'm not going to test because that's not what I was taught. Make sure everything stays in the sterile field. Then I'm going to take my KY, garbage. I'm going to put that in here. And, you know, your poor patient, they're like all exposed and stuff while you're getting all this prepared. But that is the way it is. So, I'm not close enough to my patient because I pulled my table around. So I'm going to try to get a little bit closer without messing up my sterile field. All right. So, my table wants to run away. All right. So now I'm going to take this by the inside. You don't have to do this. You can actually keep it on a table. This is what I do. And we're going to put that in between my patient's legs, keeping the non-sterile part on the patient and the sterile stuff all together. That's what I do. Now, at this point, I'm going to take my swabs. You're going to go top, down on one side, throw it away. Top, down on the other side, throw it away. Then top, middle, and throw it away. You do not reuse those. Now take your catheter. You're going to lube this up with your KY that you've already put on your little tray there. And then you will be able to see the hole right there. And you are going to spread with this hand, because this hand now is not sterile. You can't use this hand for anything sterile now. And then with sterile technique, you're going to insert into their urethra. That does not want to go in there.
Okay,
I bet
there
they've
it
got a
goes.
balloon block in there.
It's kind of going. So, yeah, there it goes. And that's how real people are too. I think I just needed to lube it up in there. All right, so once you get in there, this is what I was taught to do. This is what I do. I push it until you can't push it anymore.
Or until you see urine.
Or until you see urine. I usually go until you can't see it anymore. I blow it up. And then, after you've blown it up, make sure you use your full amount. And this will come back on you, so be careful. It will reinflate. Then I take this and pull it to where it stops. And you'll find a tug. All right, so then at that point, take this out. This is going to go over to the bed to where you're going to hook it. Most beds have those things there. Now, let me show you why I put the blue gloves on. So I take these off now. I have these on. I'm going to now tape this to my patient's leg. Make sure this is situated on the bed good. I might need to get a urine specimen. So through that, I need gloves on. So it keeps me from having to walk away from my patient. So, excuse me. Now I've got this hanging on my bed. I've got this taped down to my patient. Most catheter things will actually have a sticker that you can use for that. This one does not. And you can just voice that you've taped it to your patient. And you want to clean up your mess. So you can break this. And you might need to clean up the patient some. You might have some goo on there from the KY or whatever, and you want to clean them up. And then pick up all your stuff. And this will go into the garbage. So we put our patient's legs down. And then cover our patient back up. Make sure that you have labeled somewhere on this catheter the date, the time, and your initials as to when you put it in there. Make sure that it's flowing okay. If you're having trouble with it flowing, and this is just some word to the wise, if you're having trouble with it flowing, a lot of times it will get vacuum sealed, and you can actually take your syringe and go to this area where you can pull urine from and kind of pull air back, and it will then start to flow. So that's one way to check things. But you'll learn all those little tips of the trade as you go. So I hope that clarifies everything. If you all have any questions, just let us know.